Hey everyone, welcome back to Skinfluence. I'm your host, Dr. Dustin Portela, board-certified dermatologist. Today we're going to be exploring the connection between your mind and your skin. As always, I'm joined by my co-host, Austin.
I'm Austin Lee, physician assistant here at Treasure Valley Dermatology. It is interesting how connected the skin and your overall well-being and mind are.
Yeah, there's a whole subspecialty called psychodermatology, and we're kind of going to dive into that today. There's a few dermatologists that I've gotten to know over the years that are board certified in both psychiatry and dermatology. It's quite an interesting crossroads, and there's more overlap than people would guess.
Yeah, I would say when I was in school, they touched on it briefly, but you see it fairly frequently in the office.
And even if there's not a full-on, mental health disorder, the way that your skin looks and functions has a large impact on how you feel about yourself.
100%.
And so we do a lot of mental health counseling for our teenage acne patients, for patients with bad eczema, for
psoriasis,
individuals who have public-facing jobs. There's a lot of overlap that we address without necessarily being a mental health provider.
Totally.
So it's an interesting area to dive into. I've always been fascinated by psychiatry, psychology, and wish I would have taken more classes on it in college.
Yeah.
But it's fun to learn a little bit. And so we're going to dive into that today. And the question that I get all of the time when somebody comes in with a new rash is, could stress cause this?
That question is posed almost daily these days. And often the answer is, it could.
Yeah. Maybe.
Yeah, maybe.
So my typical response when it comes to stress in the skin, did stress cause this, is I don't think in most cases stress is the primary cause, but it can certainly make almost any skin disease worse. So when our body releases cortisol in response to stress, it does a number of things. So it impairs the production of proteins and lipids in the skin that form your moisture barrier. So you're more likely to have flares of eczema. You can have flares of psoriasis. You go into fight or flight, you're releasing more adrenaline, epinephrine, and then you can become flushed. You're losing more heat, more water through the skin. So in most circumstances, stress can definitely make your skin disease worse.
Yeah. I often have patients who struggle with psoriasis is usually the big one where they know when a flare is coming on often because they're feeling stressed. They know they're coming into a stressful time of work. Accountants who are coming into tax season and their psoriasis is flaring, and often they'll know sometimes when they're about to get sick.
Yeah,
their body starts fighting something, psoriasis starts to flare, and then all of a sudden they have the flu or a cold or something along those lines.
They get run down. Yeah.
So there is a connection, like you said, with certain skin conditions and your stress levels, cortisol levels, and things like that. So
I would say hidradenitis suppurativa is another one.
Yes.
Where individuals get stressed. And that can be such a self-defeating cycle because when you have a flare, you're uncomfortable, you get more stressed, you're socially anxious, and then it can perpetuate and get worse and worse.
Yeah.
So it can be a very self-defeating cycle when you get into some of these because it seems like there's no way out.
Yeah. Very often people, as humans, we all have ways that we deal with stress and anxiety. And some of us take out our emotions on our skin.
Yeah.
And so sometimes that stress, you may not have specific skin conditions, but you start scratching at, picking at your skin, picking at your nails, picking at spots in your skin. You're not even conscious that you're doing it.
Yeah.
And then all of a sudden you're bleeding and you have ulcers or lesions and you're thinking, what the heck just happened?
Yeah. A common condition that we see is prurigo nodularis, where individuals have a lot of hyperactivity of the nerves in the skin, and they only get relief by scratching and picking, and they get sores all over their skin or through their scalp. And it can be a very difficult one, but stress is the underlying precipitator for a lot of that.
Yeah.
And so we have medicines that we can use to try to mitigate that, to try to reduce the sensitivity of the nerves. There's a couple that have been approved by the FDA in recent years, which have been helpful. But ultimately, we just have to try to break that cycle.
Yeah.
Trichotillomania is another one, which is a psychodermatology condition where you have this stress, this tension that builds up, and it only is relieved by plucking hair out. And it's common in kids.
Yeah, very common in kids.
So.
An ICD-10 diagnosis is compulsive excoriations,
Mm-hmm.
where you're compulsed to pick at your skin. Same thing with pulling your hair and things like that. And so it's interesting how very often when these patients come to the office, it's not uncommon for them to say, you're the third, fourth, fifth provider I've seen, because these are difficult cases. And a lot of times it's telling the truth and trying to help them understand where this is coming from. And it can be a hard conversation sometimes, but patients are usually appreciative when you show empathy and respect, and that you care, and not that just you're a crazy person and you're we're all dealing with hard things in life, and so when they're heard and listened to, it helps to talk through what's kind of going on. But they're not just crazy. That's the thing.
No, they're real sensations in the skin, and I've always been one that will be honest with patients.
Yeah,
and there's some people may be listening or who may find this on YouTube, and they'll talk about a condition called delusions of parasitosis or Morgellons disease. Mm-hmm. And I'm always very honest with patients. We'll do biopsies or skin scrapings, but if I don't see bugs or parasites, I'm not going to tell them that I think they have that.
Right.
I'm not going to prescribe medicine that treat something that I don't have evidence for. And that is frustrating to some patients, and they may then go on to find their sixth or seventh provider in that case. But in many cases, as you said, showing empathy, listening, validating the symptoms that a patient is having can help to lead into an honest and frank discussion. And I've had a lot of success with just saying, you are having real symptoms. I believe you. Mm-hmm. I don't think it's caused by what you think it's caused by.
Yeah.
And I have methods that we can employ to help if you'll give me the trust and a couple of visits to work on this.
Yeah.
And in some cases, we have great success. And in some cases, I unfortunately don't see the patient back because they'll go somewhere else. And I think it's very tough when a patient continues to go to urgent care or their family doc and they just get anti-parasitic treatments when they don't truly have a parasite, because ultimately we're not addressing the root cause of what's going on for that patient to help them feel better and to look better.
Yeah. But we're here not to just treat conditions, we're treating people.
Yeah.
And so sometimes it can be easy to lose sight of that when you're seeing 40 patients a day, but the person sitting in front of you is a real person and with real feelings and real things going on in their life and in their skin. So it's important that, to be honest, like you said, and I will do things to try to show them. So if they think they have parasites, I'll do a skin scraping, look under the microscope, sometimes even do a little biopsy just to say, look at, like, we removed the skin, there's no sign of that, but to try to put them at ease, and then we could hopefully use that to open up a discussion into other things. But
those conditions are not super common. Something that's more common would be acne, and I've definitely had breakouts happen under periods of stress.
Oh yeah, that is one of the hallmarks of me being stressed is I will get pimples.
Yeah. So I've told the story on the podcast before of having a pimple right on the tip of my nose at med school graduation. Yeah. Was traveling a bunch, really excited for med school graduation, in the middle of a move, had 2 young kids, a lot of stress, pimple on the tip of my nose in every med school graduation photo for somebody that was going on to become a dermatologist.
It's the beautiful irony of life.
Yeah, it's almost too appropriate.
Yeah.
So other things that are going to impact the skin from a psychological standpoint is going to be sleep deprivation. Totally. People suffer from insomnia. They have trouble falling asleep, staying asleep. And when you are not getting that regenerative time, that's when your body is healing. It's producing more proteins, more lipids. Your skin barrier function is going to suffer.
Yeah. And very often it's at night when their minds go to dark places. The reality or stressors will set in. We're distracted during the day. We have things going on. We have people relying on us. And then at nighttime, as you're lying in bed, all of a sudden your mind starts racing into a million different things and you become stressed. And then that stress can lead to the things that we've talked about, skin conditions, and then it leads to lack of sleep. And then it's just this vicious cycle of poor health, poor skin, and it's hard to break it.
When you're underslept, at least for me, I'm much more likely to make poor food choices.
Oh, totally.
Much more likely to skip my workout in the morning.
Mm-hmm.
And so then you have now, instead of just sleep deprivation, you've got bad food and you're not working out. You got 3 different things that are going to lead to worse health and then exacerbations of your skin condition.
Yeah.
And we see that all the time. So sleep deprivation is huge. The gut skin axis is another area.
Yes.
We have more serotonin production and receptors in our gut than we do in our brain.
Yeah.
And serotonin, you know, it's the happy chemical. It's what keeps us even keel.
Mm-hmm.
And when your gut microbiome gets out of balance because of poor food choices, not good sleep, that's going to impact your gut microbiome, and that will have a huge impact on your skin.
Yeah. And very often these patients, because they're seeking help so often, are going to urgent cares where they're being diagnosed with sores on their skin as a bacterial infection, and they're on chronic antibiotics,
Mm-hmm.
which is also hurting their gut. And so getting accurate diagnoses, not putting on medications that are going to hurt that are beneficial to them. But poor food choices, they definitely affect the way you look. They affect your skin. They affect your sugar levels. Those sugar levels are going to affect cortisol, and then it's that whole cycle that we talked about all over again.
Yeah. I've had some relatively good success with high-quality probiotics on patients who have chronic skin conditions.
Yeah.
I've prescribed them, they're not prescription, but recommended them to patients with hidradenitis, with perioral dermatitis. That's probably the area that I've seen the most benefit in is perioral dermatitis.
Interesting, yeah.
Is a really good high-quality probiotic. The one that we carry in the office is from Pendulum, the Metabolic Daily. I've seen good results with that because these patients are often on multiple rounds of antibiotics,
Yes.
like you said, and their gut bacteria is just wiped out.
So putting them on a good probiotic, that's a great. I'm gonna start trying that. I don't think I've tried probiotics for periorificial dermatitis.
Yeah.
Especially recalcitrant cases. So, and very often you're putting them on antibiotics, doxycycline, to treat really
azithromycin.
Yeah.
So it's something that I found good success with. Not in every case, but in many cases it seems to be helpful. I'm not saying it's a cure for everybody. Definitely was a cure for one patient, but most patients find that it is overall helpful in getting them back to normal skin. So it's just one of the areas that as dermatology providers, we do ask our patients about their stress if they're not bringing it up and talk about ways to help manage that. And I'm often recommending books or meditation exercises that they can employ to try to get good control of their stress, the way that they feel about themselves, and it makes treating the skin easier.
Yeah. I'll say lately I've been posting a little bit more on social media about practicing stillness, meditation, journaling, things to de-stress and how that'll help your skin. And I get texts from a lot of people I know asking more about that. I've had more engagement personally with those posts than I have with any other posts. It's been interesting.
Very interesting.
Yeah.
So let's move into a little did you know when it comes to stress and the skin.
Yeah. This is a real thing that I've encountered in the office where people who struggle with chronic skin conditions where they have rashes that cover significant parts of their body, including their face, they're twice as likely to suffer with depression than the normal population.
Yeah.
And I see it often where they'll come in and they're wearing long sleeves in the summertime to try to cover up because people look at them and think, what the heck is going on with your skin? You're flaking everywhere. Are you contagious? What is it? They don't know what it is. And they struggle with being out in public. And it's a sad thing to see, but it's very satisfying and it makes me happy to see that we have things that can help them.
Yeah.
So.
I had one particular patient who had terrible psoriasis, and they came into the office in the summertime, like you said, with a sweatshirt, the hood up over and cinched down. The best I can liken it to is Kenny from South Park.
Yeah.
Like basically you could see the eyes. They had a ball cap and a sweatshirt covering up, and it was cinched down. And when we got them to take everything off, they were 90% covered in psoriasis.
So sad.
We started them on a biologic medication that was appropriate for psoriasis. 12 weeks later, they came in shorts and a t-shirt and a big smile, and it was life-changing.
It's life-changing.
So it didn't just treat their skin, but they were no longer, depressed and socially withdrawn.
Yeah.
And it was remarkable to see.
Yeah.
And Accutane patients who come in with terrible acne, they don't want to look you in the eyes. And then 6 months later, they're finishing their Accutane and they're beaming. They're bright. They're happy.
Yeah.
So I've had to do more suicidal questionnaires for patients with severe skin disease, eczema, psoriasis that covers 90% or more of their body, where they've expressed significant depression to me that I have to make sure they're not going to hurt themselves.
Yeah.
And, so there's a huge component of depression and anxiety with some of these skin diseases.
Yeah.
And along that lines, studies have shown that mindfulness and relaxation practices can reduce flares of psoriasis by up to 40%.
It's amazing.
And so that's a non-drug, non-side effect type of practice that you can employ that can actually help your skin without having to get on more pharmaceuticals.
Yeah. We live in a day and age that's so fast where everything needs to be a quick fix. Everything is up in your face. Life moves at you quickly. And slowing down for at least a few moments during the day, or trying to take 20 minutes where you just sit in stillness and focus on breathing and meditating and finding peace has been, it's a life hack.
Yeah.
Like it's truly a life hack to better skin, better health, better mental faculties. And it's sad that we're pushing past that to just, in the pharmaceutical, cosmetic, retail world of we have an answer for this. But the answer is just go find a quiet place for a minute and listen to the Tibetan bowls and, like be calm.
The practice that I think would help almost everybody is 15 minutes of walking outside in nature. And if you live in a huge city, even just walking along the river or through a park, 15 minutes, no headphones. You can't be on your phone. You can't be listening to a podcast. You can't even be listening to music, even if it's peaceful music. You need to listen to the sounds that are happening in the world.
Not even Skinfluence.
Not even Skinfluence. That maybe you can listen to Skin. No, you shouldn't even listen to Skinfluence. But 15 minutes, you're going to get your steps in. You're going to get, probably a couple thousand steps. You're going to get your heart rate up a little bit, but just they have shown that 15 minutes walking in nature significantly reduces stress.
I believe it.
So that's what I would recommend, because some people, it sounds a little quirky to sit and meditate and pay attention to your breath. And all you got to do is walk in nature for 15 minutes.
Yeah.
With no distractions.
And you're getting vitamin D.
Getting a little vitamin D.
It's fine.
Absolutely. So some interesting did you knows. So let's move into part 2.
We've talked about how stressors can cause a lot of issues, and we've talked a little bit about how slowing down can help, but how would cognitive behavioral therapy and mindfulness help to break what's called the itch scratch cycle, which we've talked about with prurigo nodularis and eczema and all these conditions that are inflammatory in our skin?
Cognitive behavioral therapy is one of the most validated forms of psychotherapy, if you will, to help overcome things that people are really fixated on. So if you have severe insomnia because your mind is racing, if you have a fear of something specific, cognitive behavioral therapy and the way that they work through that with proper exposure and reframing is one of the most effective ways to overcome very specific challenges that you face with your mental health. And so if you are fixated on something or something specifically is stressing you out, and you can go through professional cognitive behavioral therapy with a licensed therapist or psychiatrist and reframe that stressor, you're less likely to take it out on your skin when you're picking, scratching. And so I highly recommend cognitive behavioral therapy as a modality to overcome some of these specific stressors that they're generally things that people are very specifically fixated on. And so if you have tons of different things that are stressing you out, I don't know as much, again, I'm not a psychiatrist, if cognitive behavioral therapy is the best way to address multiple things. But if there's a couple of very specific things, specific traumas that you've been through, I think CBT is highly beneficial for those kinds of situations.
Yeah. Yeah. I haven't personally been through cognitive behavioral therapy. We study it in school, but it's probably something that could be recommended more for certain patients?
Yeah. I think the biggest problem is it's really hard to find mental health providers because we have a lot of need for mental health providers and there's a shortage of them essentially. And so getting that help. So there's a lot of tools online that you can go to, and I'm not advocating for some of these apps that you can get on where you connect with a therapist remotely. I don't know how good they are, how often you're connecting with somebody you really jive with, but if that's all the resources that you have, I think it's definitely worth looking into.
Yeah.
If you don't have a therapist in your area, you can get into. But there's a lot that you can do on your own to minimize the impacts of stress on your own body.
Sure.
Walking in nature, like we talked about, getting good sleep hygiene, I think is huge.
Yeah.
Because the downstream effects of poor sleep, like the food choices and working out and all of that, is very impactful on our lives. And sleep hygiene is one of the things that I've really done a much better job about over the last probably 2 to 3 years. When I was going through medical school and residency and then starting the practice, terrible sleep hygiene.
Yeah.
I was burning the candle at both ends and it had an impact on me.
Yeah.
But as I got to a point where I could balance better, I've really done a much better job prioritizing sleep and getting 7 to 9 hours every night.
Yeah. 7 to 9 hours are going to allow your good heart rate variability, because if you're too low, it means you're not sleeping long enough, and it means that your body is still basically active. You're not going into the mode where rest and digest, basically, where your body's going to repair the skin. Your cortisol level is going to be higher, your sugar level is going to be higher, and it's going to have a negative effect not just on the skin, but on multiple organ systems that are just going to make you sick. You're just going to feel it.
Almost everybody, I shouldn't say almost everybody, but so many more people now have access to tools that will track things like their heart rate and heart rate variability. I use the Oura Ring. A lot of people have the Apple Watch or the Garmin Watch. And there's somebody in the social media world named Brian Johnson. I don't know if you've ever followed him. Brian Johnson is the guy who has this campaign called Don't Die. And he's testing everything to live to be, well, essentially not to die, but he wants to live longer than anybody's ever lived. And he's got millions of dollars to test everything out. Yeah. But I saw a tweet from him recently that said that the number one thing that correlates with all of his other biomarkers, and he does thousands of dollars of lab work a month, is your resting heart rate before bed. What is your heart rate before you fall asleep? And a nice, low, consistent heart rate before bed is the number one biomarker that he's turning to see what his health is doing.
Really?
Yeah. And I thought it would be like heart rate variability as you sleep. Yeah. But he said the resting heart rate before bed.
Resting heart rate before bed.
So if you have an Apple Watch, if you have an Oura Ring, you can look at what your heart rate is after you get in bed and relax. And if your heart rate is typically, in the 60s and for a few nights like it's in the 80s, you're maybe overstressed and you need to look at what's causing that. Are you getting sick? So I've noticed if I eat a late meal, my heart rate's going to be higher. But if I don't eat after, 7 o'clock at night, my heart rate's going to be in the 50s before I fall asleep. And my resting heart rate as I sleep will be low 50s to high 40s. And so I can track that. And if I wake up in the morning and I look at my data and my heart rate was in the 60s all night, I'm like, something's stressing my body. Yeah. And I got to make a change in my daily routine to mitigate that.
Right.
So
interesting. That's an interesting fact, because I've used heart rate variability for a long time. Yeah. I
think heart rate variability is still very valuable. And essentially what that means is your heart beats consistently, right? We know ba-dump, ba-dump, ba-dump. But your heart doesn't beat every second.
Every perfect
second. It beats sometimes 0.7 seconds and then 1.3 seconds. And actually having variability in how frequently your heart beats is healthier than if your heart is beating exactly the same time between beats. And when you're running, your heart's going to beat much more consistently at its same pace because your heart's working hard. But at a resting state, you had good heart rate variability. So one of the metrics that my Oura Ring gives me is that heart rate variability. And what I can usually see is that my average heart rate variability through the night, I like it to be over 70 for me.
Oh, really?
Yeah. And if it's consistently in the 30s, I'm like, I got to do something different because I'm going to bed too stressed or I'm eating too much late at night. So I can see my average heart rate variability and then my max heart rate variability. And invariably, no pun intended, my heart rate variability is lower in the early hours, and then throughout the night it becomes more variable. And so I'm like, that's probably something that I'm eating, late at night, because I want that heart rate variability to increase earlier in the night.
Oh, gotcha.
So caffeine, if I drink caffeine in the afternoon, it's still in my system and it's causing my heart to beat faster.
Yeah.
In the earlier hours of my sleep versus later towards the morning.
Right. Interesting. Mine's been low for the past few weeks.
Yeah.
And last night was the first night where I was up in the 60s again. I was in the green. I was like, oh, okay.
Yeah.
And I think it's eating late.
I've
been on vacation for 2 weeks. Eating a bowl of cereal 9 at night.
I got Count Chocula for a Christmas present.
It's a killer. It's so good.
I love my Count Chocula.
Yeah.
It's my favorite cereal. And I can only get it in Halloween time. Yep. Somehow my wife got it for me as a Christmas gift. I don't know where she found it.
Amazing.
And this is a bad habit, I'll confess to the audience. I'm an almond milk drinker.
Oh, yeah.
But almond milk in Count Chocula just doesn't do it.
No, you can't do it.
So I do regular milk, and it's the only time I do regular milk. And then I've started adding a splash of heavy whipping cream. And it's so delicious. It takes the flavor profile up.
That's
and
amazing.
That is my treat, is Count Chocula. I do this once a year. Count Chocula, pour in the milk, a little splash of heavy whipping cream.
There you go.
So
and what time of the day are you doing that?
Oh, it's usually late at night.
Yeah, 100%.
Kids went to bed. I'm craving a bowl of cereal. I only have one box of this stuff. And if I don't eat it, my kids are going to get to it the next morning.
100%. You got it.
I have to do it. So it's bad.
Amazing.
I just confessed that to the audience.
Same things.
So,
yeah.
But yeah, the heavy whipping cream, that's a hack for the best cereal.
I'm going to try that.
Yeah.
I'm going to try it.
And then report back on your heart rate
I'll
variability.
let you know tomorrow after I did it at 10 at night.
I think it would be important, as we're talking about psychodermatology, to touch on Accutane, because a lot of people have worries about Accutane and mental health.
Yes.
And so how do you counsel your patients when it comes to the risk of depression and Accutane?
So I'm usually the one to bring it up. I like to kind of make sure that my patients have a provider who's actively aware of some of the myths and side effects. And so I'll say something you may hear or you may have heard is that Accutane can cause some depression and suicidal ideation. This has been studied since it's come out. The American Academy of Dermatology has been really thorough about this. And what they claim is that there really is no correlation between those two things. I will tell my patients that I've had a handful of patients. I've prescribed Accutane at this point thousands of times. Mm-hmm. And I can think of, maybe I can count on one hand the amount of patients who have said, I feel depressed on Accutane. Mm-hmm. And I'm not going to say, no, that's not a side effect. We're going to take them very seriously, and we're going to talk, do we want to go down on the dose and see how it goes? Do we want to stop altogether? What are you feeling? Are we suicidal, or are we just feeling lethargic and depressed? Mm-hmm. And we have a discussion about it and then make an adjustment from there. I think one time we had to stop because the patient was just feeling too lethargic. They didn't want to do anything.
Yeah.
But I have had patients who are clinically depressed and suicidal, seeing psychiatry, seeing therapists, and I work very closely with them, and we had them go through Accutane. And like we've talked about before, their depression and suicide went down. Mm-hmm. It improved because they don't have this cystic scarring acne that that's what people see, and that's how they perceive themselves, is just having bad acne. And so when they can present themselves with clear skin, they feel better about themselves.
That really is an excellent point, because they have studied this extensively when it comes to depression and Accutane. Mm-hmm. The age-matched control study. So they take a group of patients that has been treated with Accutane and a group of patients that was not treated with Accutane, but they look similar. The ages of the study populations, the gender, the socioeconomic status.
Yeah.
And they have only found either the same rate of depression in Accutane-treated groups and non-Accutane-treated groups, or better mental health outcomes in the Accutane treated groups.
Yeah.
But they have not shown worse depression in the Accutane treated groups.
Yeah.
But any medicine can cause any side effect if you give it to enough people. So I think on a case-by-case basis, we do consider that.
Yeah.
I've had one patient that got depressed while taking Accutane. We stopped the medicine. They got treated for depression. They came back to us and we finished their course of Accutane and they did great.
I believe it. And they felt great about themselves, probably.
Yes, absolutely. So I'm confident in saying that Accutane does not cause depression when we look at the population studies.
And I agree, yeah.
So, but that just goes to speak that as dermatology providers, we do work closely with mental health providers because there is so much overlap. We do a lot of that counseling, but in the right circumstances, we will bring in our colleagues to make sure that patients are being treated appropriately for their skin and for any underlying mental health conditions.
Yeah. And just like you've said before in the past, when we're treating people, our patients are not our skin, their skin. They are a human, they are valuable, they carry worth just by being here and not by the appearance of their skin. We're here to try to help, but it's not what your skin looks like is not who you are as a person.
Very well said. That being said, we do want to provide you guys with some resources that we have found helpful. We talked about measuring your heart rate variability, your resting heart rate, those things. I'll have a link to the Oura Ring. I've used that for 5 years, and I love the data that I get off of that. It helps me make better choices to take care of my health. And then we will feature, once again, Kill Switch. This is a sleep supplement that I love. It really helps me sleep well. I don't feel groggy the next morning. And if you've tried this, give us feedback on Instagram. Send us a message at skinfluence_pod. We'd love to know if you liked it or any of the products that we've recommended on the podcast thus far.
Yeah.
So thank you for joining us for this episode. I'm Dr. Dustin. You can find me anywhere on social media at Dr. Dustin Portela.
And you can find me on social media at Austin Lee PAC.
We'd love it if you left us a 5-star review wherever you listen to podcasts and share this episode with a friend, and we'll catch you next time.